Does dandelion root interact with medications? Have you ever wondered if dandelion root, a popular natural remedy for digestive issues, interacts with medications? This is a great question, especially for those managing sensitive stomachs, irritable bowel syndrome, or colitis. Let's break it down in simple terms. Dandelion root is often used to support digestion and liver function. It is generally safe for most people when consumed as food. However, it contains active compounds that can influence how your body processes certain medications. One way dandelion root may interact with medications is through its diuretic effect. This means it can increase urine production. If you are already taking diuretic medications, adding dandelion root could raise the risk of dehydration or electrolyte imbalances. This is particularly important for those with sensitive digestive systems, where maintaining fluid balance is essential. There is also some evidence that dandelion root might interfere with the absorption of certain antibiotics, especially ciprofloxacin. The minerals in dandelion can bind to the antibiotic in your gut, making it less effective. To avoid this, it is best to separate dandelion supplements or teas from these medications by at least 2 hours. If you take medications for diabetes, be cautious with dandelion root. It may lower blood sugar levels further, increasing the risk of hypoglycemia. Monitoring your blood sugar closely and consulting your healthcare provider is a wise approach. For those on blood thinners or medications that affect blood clotting, dandelion root should be used with caution. There is a theoretical risk that it could slow blood clotting, which might increase the chance of bruising or bleeding, especially for those with bleeding disorders. Lithium, a medication used for certain mental health conditions, is processed by the kidneys. Since dandelion root has diuretic effects, it might change how lithium is cleared from your body. This could lead to higher lithium levels and increased side effects. If you are considering dandelion root while on lithium, medical supervision is important. For individuals with sensitive stomachs, irritable bowel syndrome, or colitis, introducing any new supplement, including dandelion root, should be done carefully. While many tolerate dandelion well, it can sometimes cause digestive upset. Starting with a small amount and observing how your body reacts is a practical strategy. If you have gallbladder issues, such as gallstones or bile duct obstruction, it is best to avoid dandelion root due to its effects on bile secretion. Always discuss with your healthcare provider before starting dandelion root if you have these conditions. Dandelion root is rich in potassium, which can help offset potassium loss from its diuretic effect. However, it is still important to monitor electrolyte levels if you are prone to imbalances, especially with chronic digestive conditions. Allergic reactions to dandelion are rare but possible. If you are sensitive to related plants like chamomile or yarrow, watch for signs of allergy, such as itching, rash, or digestive discomfort. In summary, dandelion root can interact with diuretics, antibiotics, blood thinners, diabetes medications, and lithium. It may cause digestive upset in sensitive individuals, so starting with small amounts is wise. Avoid dandelion root if you have gallbladder disease or bile duct obstruction. Always inform your healthcare provider about any supplements you are taking, especially if you have a chronic condition like irritable bowel syndrome or colitis. This approach helps ensure safety and effectiveness for managing your digestive health.